tomorrow. A new study from the University of California, San Francisco says nearly 1 in 3 young adults may be especially vulnerable to the coronavirus. Our Dr. David Agus joins us from Los Angeles with more on that part of the story. Hey, David Agus, very good to see you. So what is happening with the young people is my first question. And for the purposes of this conversation, what do we mean by young people? The age range from what to what?
Good morning, Gail. I don't want to offend you on this, but young in this study is kind of 18 to 25. And what it's showing is that a lot more... Either am I, believe me. What it's showing in this study is that a lot more of them are at higher risk for complications from COVID than was previously thought. You know, what's been observed is over the last several months, there's a 300% increase in this age group being admitted to hospitals. And what we know now is that a third of them are higher risk because dominantly they've been smoking in the last 30 days, as well as other medical conditions. But smoking dwarfs all of the other issues.
Yeah, we've heard about smoking and vaping, and a couple of vaping advocacy groups have told us in statements that the data does not tie vaping to COVID-19. What are your thoughts on that?
Well, I don't think we're tying COVID-19 to vaping, but certainly vaping in the last 30 days and tobacco in the last 30 days, we think puts you at significantly higher risk for complications from COVID-19 because of the inflammation in the lung. And it really needs to be proven otherwise in a definitive study before anybody will back away from that statement.
And researchers in London have found that people who recover from COVID-19 may lose their immunity sooner than first thought. What does that mean?
So this was a study that followed hospital workers, and 60% of them had antibody levels 3 weeks. That's the highest antibody goes, 3 weeks after infection. That will prevent the virus, and we thought can give them protection. But when you look 3 months later, that number is down to 20%. So the antibodies have a very short half-life. It's not as doom and gloom as it sounds, because much of the immunity to COVID-19 is from T cells, and we aren't measuring them in these studies. And T cells have a memory and provide immunity against the virus after being exposed. The vaccines are given in 2 shots, so we can get a much higher concentration of antibodies than you were just infected with the virus. So coupled with the vaccines and the T cell part of the response, both to the vaccines and the virus, my hope is it lasts significantly longer immunity to the virus.
Now, what everybody wants, David Agus, you know, is a vaccine. I know you've been working on a database to advise volunteers about this. What are you finding? How is that going is a better question. How's that going?
Well, what's exciting is that this is a database where you log in online and everybody in our audience can log in. They can volunteer to be part of the phase 3 clinical trials for the vaccine and the antibody. And we're looking for people of every race, every part in the country, every age to have a distribution and to enroll people. It was announced by Dr. Fauci and the NIH mid last week. There are already 60,000+ people, I just checked this morning, that have been volunteered to be part of this, heroes who want to be part of the solution. And later this week, there's going to be a lot more media on it, so those numbers are expected to rise significantly. We're looking for 1 million people in total to be volunteers in this program.
Hey, David, we had a report on this broadcast earlier about the White House seeming to try to discredit Dr. Fauci, who, as you know, is widely respected according to the latest polls. You know both sides here. What is your take on what is happening?
Well, he's widely respected, not just according to the polls, he's just widely respected. I honestly don't know. I mean, Fauci is a voice of reason in science, and he is a powerful leader for what is happening with COVID-19, and the country trusts him. In order to get normative behavior change, you need leadership, and he has provided leadership, and so I'm behind what he's pushing. Obviously, there's been a lot of infighting in the White House on all different areas, and I don't know what's specifically happening between them, but I hope he continues to lead.
Yes, I think many people hope that. Dr. Fauci always says stick with the science. I always take that to heart. Thank you very much, Dr. David Agus.